Hello, my name is Alexander Becraft. I studied psychology and social entrepreneurship at the University of Utah. And here I'm going to present to you our study, which is titled Mental Health Prevention and Promotion, Leveraging Positive Psychological Interventions and Social Entrepreneurship to build resilience and well-being in college students. I'm the principal investigator of this research study. I'm also the CEO and one of the founders of Wellbeing Elevated, which is now known as WeBeWell. And in this study, our research team evaluated the impact of a 6-week multimodal well-being program developed by WeBeWell on components of mental health and well-being. And WeBeWell delivers evidence-based skill lessons from positive and clinical psychology created by doctors Ed and Carol Diener and others developed by the WeBeWell team. And we deliver this curriculum through app and web technology and meet in Zoom-based peer support group settings to discuss our well-being concepts, reinforce our curriculum, and facilitate connection. I would like to take a minute to highlight and thank our team whose work and research have made our program and this presentation possible. And that's Mitchell Wolfman, Mary Joseph, and Ayana Amici. I would also like to thank Dr. Yoonju Oh for conducting data analysis on this data set and other research team members, Sydney Sarter and Aaron Case. I want to express my gratitude for my faculty mentor, Dr. Marissa Diener, and the study's faculty sponsor, Dr. Nick Ghali, both of whom have been incredibly helpful, supportive, and encouraging in this process. In addition, I would like to express my profound gratitude for Doctors Carol and Ed Diener, both of whom have been such incredible mentors and friends, and without whom none of this work would have been possible. Here's an outline of the topics that I will cover throughout the presentation. Because of my roles and interests with WeBeWell as a social enterprise and as a researcher evaluating this program, I have a financial conflict of interest, which has been reviewed and managed by the University of Utah's Conflict of Interest Office and the Institutional Review Board. I would also like to thank our funders for their generous support. Their grants have made our research and work possible and empowered our team to serve the well-being and mental health of hundreds of students at the University of Utah and individuals in other places as well. And this includes Eric and Wendy Schmidt and the Schmidt Futures Organization, Clark and Christine Ivory, and the Office of the President at the University of Utah. In particular, I would like to thank former President Ruth Watkins, Courtney Macbeth, Lori McDonald, Danielle Keddington, Laura Snow, and Chris Ostrander for their support through the American Dream Ideas Challenge. There is what has been deemed by many, including the Chronicle of Higher Education, to be a mental health crisis on college campuses across the United States. To paint a picture of the trajectory of this crisis, I will be sharing data from the Healthy Minds study. And this study assesses the prevalence of mental health conditions, service utilization, and related issues among undergraduate and graduate students. And the Healthy Minds Network has surveyed over 500,000 students from almost 400 institutions. Over the past 15 years, mental health issues have steadily been rising at the college level. From 2007 to 2017, there was a 14% increase in the number of students with a lifetime diagnosis of mental health conditions, according to researchers at the Healthy Minds study. In 2018, Daniel Eisenberg of the Healthy Minds Network found that 38% of students at the University of Utah were experiencing at least one significant mental health issue, be it anxiety, depression, or even suicidal ideation. And at that time, approximately 58% of these college students went untreated. While the majority of mental illness presents itself between the ages of 18 and 25, universities across the United States, it does not matter the institution, lack the counseling resources to keep up with this unprecedented spike in demand for mental health resources. And currently, the Active Minds organization has stated that 67% of individuals between the ages of 18 and 24 with anxiety or depression actually do not seek treatment. Here we have some more recent data from the Healthy Minds study from really large national samples. And as you can see, in 2020, 37% of student respondents screened positive for moderate to severe depression. And just 1 year later, that number increased by 5%. And there was also a significant uptick in students who screened positive for moderate to severe anxiety between 2020 and 2021. The stressors of the COVID-19 pandemic have intensified what was already deemed a dire situation, and college student mental health has never been more important. And now I'd like to share a bit of data from the state level in Utah. In 2019, the Kempsey Gardner Policy Institute and the Utah Hospital Association published a report that elucidated some very alarming realities. And the authors of that report, Summers, Meppen, and Ball, ranked Utah worst in the nation on adult mental health measures based upon our high instances of poor mental health and low levels of access to mental health care services. In addition, they found that Utah had the 5th highest age-adjusted suicide rate in the nation at that time. Thankfully, as a state, we do have greater access to mental health care in very large part due to the Huntsman Mental Health Institute and the University of Utah. In addition, at the state and national level, there is more focus and funding for mental health care than ever before. But there is still much progress to be made. The former director of the National Institute of Mental Health, Dr. Thomas Insel, was quoted in a Wall Street Journal article as stating that one of the causes of the mental health epidemic is that our current healthcare system is designed to handle crisis, but not to prevent problems before they arise. As a society, as educators, students, leaders, and as human beings, we need to make a shift in the way that we address mental health. And there is a substantial need for greater well-being and mental health prevention programs, in addition to options for those suffering from subclinical and moderate mental health problems. And this was certainly the message of our mentors, Drs. Ed and Carol Diener, and one of the reasons why they developed a preventative well-being skills course called Enhance. Dr. Carol Diener is a child clinical psychologist, researcher, award-winning educator, and an attorney. And Dr. Ed Diener is considered one of the founding fathers of the field of positive psychology. He is one of the most highly cited research psychologists in history, and the Gallup organization recently referred to Ed as the most preeminent well-being scholar of the past half century. Dr. Ed Diener is known for pioneering different work in psychology, but perhaps most notably for his development of the construct of subjective well-being. And Dr. Diener identified subjective well-being as the scientific study of happiness and life satisfaction, and it has 3 components. The first is often called positive affect or positive emotions, and this includes emotions such as joy, gratitude, contentment, among others. And the second component of subjective well-being is lower levels of negative emotions or negative affect, such as sadness, stress, worry, anger, and others. And the third component is what Dr. Diener called life satisfaction, which is a cognitive and personal judgment one makes that their life is going well. And there is a direct link between subjective well-being and both mental and physical health. As I mentioned, the Dieners developed a well-being skills course known as Enhance, which is comprised of an array of skill lessons drawn from the fields of positive and clinical psychology. And the curriculum and program were designed to improve different components of well-being and to reduce symptoms of poor mental health. In several randomized control trials, the program exhibited an array of incredible benefits to participants, including decreases in stress, anxiety, and even fewer sick days at school and work. Other benefits were increases in happiness, well-being, physical activity, and attention and memory. Our team worked with the Dieners to facilitate the scalability of the existing program by making some adjustments. The first was that we reduced the program from 12 to 6 weeks. We also utilized an app to deliver the curriculum. The initial program was facilitated by 2 graduate level clinicians. With WeBeWell, we designed and implemented an entirely new peer facilitated support group program around the core curriculum and also adapted some of the skill lessons. So in summary, the mental health challenges at the state and national level are ever increasing and quite drastic. And this dire situation was an impetus for our team to deliver our evidence-based preventative well-being and mental health curriculum. And our goal was to deliver the curriculum in the most practical and engaging way for the average college student, and also during the height of the COVID-19 pandemic. So our research aim was to evaluate the new program and its impact on well-being and mental health. And our research question was, what is the impact of our 6-week multimodal well-being program on components of subjective well-being, mental health, connectedness, belonging, and also academic confidence and motivation? And our hypothesis was that there will be significant differences on all mental health and well-being assessments between the baseline and post-intervention scores. So we utilized an array of recruitment strategies to engage students. We had digital outreach strategies such as email and the utilization of social media. We posted physical flyers on campus, in dormitories, and other physical spaces. And then also, we had been conducting our program for about a year before this iteration that I'll be presenting on in terms of the data. So we had past participants, students who had participated in the program that recommended WeBeWell to their peers. So there was no randomization of our sample. Our sample for the fall of 2021 was 120 University of Utah college students. And this included both graduate and undergraduate students from diverse academic backgrounds. From students who came to our first session, 83% of them completed the 6-week program and our requirements. So in other words, the majority of our participants stuck with the initiative, which is an indicator that our program provided value for the students that we served. So the average age was almost 21 years old. We did have some non-traditional college students as well. The overwhelming majority of our participants were female, but as you can see, we had students from other genders also. And we worked very hard to recruit and serve a diverse sample of students. Our sample is more diverse as a percentage compared to the University of Utah undergraduate student population regarding race and ethnicity. And we have a significantly higher percentage of students who identified as Asian, Black, or African American than the population of students at the University of Utah. Regarding ethnicity, we also had a slightly higher percentage of students who identified as Hispanic, Latino, or of Spanish origin in our well-being program than the percentage of those ethnicities at the University of Utah as a whole. In addition, our sample had a higher percentage of first-generation college students than that of the University of Utah. So 25% of students at the University of Utah identify as first generation, and in our sample, 30% identified as first generation college students. So next, I would like to discuss the actual interventions and the structure of the program. As I mentioned, it was a 6-week program. We delivered our curriculum via an app, and we also had a web platform as well. And we had a peer support group model conducted entirely on Zoom because of the COVID-19 pandemic. And this was actually a very effective medium to meet with our students. So the structure of our program is known as learn, practice, and reflect. So at the beginning of a week, a student will learn about the well-being skill or concept on the app or web platform. They'll have a brief exercise that they're asked to do and basically apply the skill throughout that week. And then they reflect individually on the experience with the well-being concept or skill, and then also reflect with the group in our Zoom setting. So each session on Zoom was an hour, and the maximum number of students we had in our groups was 10, but the average was slightly lower. So here's a list of the actual skill lessons and topics that we covered. In our first week, we have an introduction to components of mental health, and we also discuss stigma. In addition to that, we talk about different components of well-being and happiness and behaviors that foster both of those constructs. And in week 2, we help students identify and apply their unique character strengths and values. And we use a free survey known as the Values and Action Character Strength Survey to do this. And we also have strengths visualization exercises for our students. In week 3, we focus on 4 qualities of goals that are conducive to well-being. And week 3 builds on week 2 in that goals that are aligned with our strengths and values are shown by research to improve well-being, happiness, psychological health, and resilience. And we also focus on goal setting strategies that are intrinsically rewarding, the importance of having goals that are intrinsically rewarding, and also the importance of setting our goals strategically, meaning that we're moving towards them in measurable ways. In our 4th week, we focus on cultivating healthy relationships, and we do so with strategies from largely positive psychology, as well as counseling psychology. We focus on active listening, active constructive responding, and also we talk a lot about boundaries. In addition to this, we also discuss how to handle conflicts effectively. In weeks 5 and 6, we move more into the realm of stress management and cultivating behaviors and ultimately a lifestyle in which we're more resilient to the effects of stress and depression. We talk about the relationship between thoughts, emotions, and behaviors, drawing on the field of cognitive behavioral therapy. In addition, we help students identify cognitive distortions, which we call thinking traps, and how to restructure those thinking traps to more realistic and positive narratives. And lastly, we talk a lot about self-care and having strategies that can help us reduce stress in the moment, in addition to activating behaviors that can make us more resilient to the effects of stress. In week 6, we go through guided meditation and mindfulness exercises. Students have these on the app, but we also do live meditations in our Zoom-based peer support groups. Here are a few images of what the app and web platform look like. We have high quality video content for our students where we discuss the topics of the week. And we also have the content in written form broken up by pictures. We have journal functions on the app. And one other thing that we ask students to do, which they really enjoy, is engage in what we call a social gratitude practice. So each week, we ask our students to share a list of 3 things they're grateful for with their closed cohort that they go through the program with. And the reason we ask this is because there is an abundance of scientific research which exhibits the many positive health benefits of practicing gratitude in our lives. So now I would like to discuss the ways in which we collected data. We used self-report testing, pre and post intervention, and to assess components or symptoms of depression, we utilized what's known as a CESD-10. This is a 10-item, 10-question test to assess depression. To assess symptoms of anxiety, we used a generalized anxiety disorder 7 scale. And then to assess subjective well-being, which I talked about before, we used a satisfaction with life scale to assess any changes in life satisfaction, and the scale of positive and negative emotions, which is known as the SPAIN, to assess positive and negative affect, those other two components of subjective well-being. We also utilized a flourishing scale to assess positive mental health. So all of the scales that I just outlined are valid and reliable. We did, in addition to using these scales, create our own measures, which were not previously tested, to assess generally if our program may have had an impact on a sense of belongingness and connectedness to academic community. And we also created our own measures to assess potential changes in academic motivation or confidence, which I will discuss in just a few moments. So being that we utilized Likert scales and we're analyzing ordinal data, we used a Wilcoxon sign rank test to evaluate the statistical significance regarding the differences in scores between pre and post tests. And we found statistically significant differences on all of the mental health outcomes listed below between pre and post testing, which indicates that our program, Wellbeing Elevated, now WeBeWell, positively affected the college students that we served, and the size of these effects were moderate to strong. So in addition to this, we calculated percent changes, which represent the differences in median values from pre to post test, which I will now share with you. So regarding depression, we had a 33.3% decrease in symptoms of depression from before the intervention to after the intervention. And again, this represents the differences in median values from pre to post test. We had a 42.9% decrease in symptoms of anxiety, almost a 15% improvement in satisfaction with life, or increase in satisfaction with life, a 6.7% increase in positive mental health. And on the scale of positive and negative experience, we had a 9.1% increase in positive emotions and a 6.3% decrease in negative emotions. So we created our own measures, as I mentioned before, to generally assess how the program improved belongingness, connectedness, and academic motivation and confidence. And on all of these measures, they were not previously tested. We asked students, how strongly do you feel you belong to your academic community? And if we average all changes in belongingness pre to post test, our average improvement is 12%. However, the data tells a much richer story if we look at changes on individual scores or combinations of scores. So if we look at the left side of the graphs, you can see that 44.2% of students answered not at all or not very when asked about feelings of belongingness. But after the program, only 30.8% of students answered not at all or not very. Looking at more positive scores, at the beginning of the program, 55.8% of students answered somewhat very or extremely regarding a sense of belonging. And after the program, that number increased to 69.1%. So next we asked students, how connected do you feel to your academic community? The average increase in our measure of connectedness was 10.4%. So again, if we look at the left side of the graphs, you'll notice at the beginning of the program, 48.3 percent of our participants felt either not at all connected to or not very connected to their academic community. Yet after the program, only 32.5% of students responded the same way. Before our program, 51.7% of students felt somewhat very or extremely connected to their academic community. But at the end of the intervention, 67.6% of participants felt somewhat very or extremely connected to their academic community. So we asked students, how motivated do you feel to perform at your ideal level academically? And again, there was an increase here of 13.4% in academic motivation on average. Pre-intervention, 25.9% of students felt not at all or not very motivated to perform at an ideal academic level. And that number was reduced by almost half, and only 14.2% of students responded not at all or not very motivated to perform at an ideal academic level. So looking at the more positive responses, again, somewhat very and extremely, we had a 10% improvement from 74.2% pre-intervention and 85.5% after the program. So lastly, we asked students, how confident are you feeling about finishing your degree? And we saw an average 6% increase. So next, I'd like to share some qualitative data with you. We asked our students if they'd be willing to share quotes publicly on their experience with the program. And this one is from Lydia, who said, "This program is beyond amazing. I was in the program when I was suffering from a few mental illnesses. I felt completely alone. However, the program helped me feel less lonely in my challenges. The program helped me understand how to manage my well-being and realize that not every day is going to be amazing. I received amazing insight on topics we covered and use these tactics today." Lauren stated, "My experience with Wellbeing Elevated was great. I learned many valuable lessons and learned how to deal with stress from college. I just wish I would have found out about this earlier on in my college career. The lessons learned have definitely impacted my personal life along with my academic career." And Khadijah said, "This program was the motivation and change that I needed to make me feel like I can accomplish and handle any and everything in life." So next, I would like to discuss some of our limitations. As I mentioned before, the existing curriculum has been randomized control trial tested and shown to have an array of really amazing benefits. We did not have a control group with our new app and our peer facilitated group support component. So we didn't have a control group in this study, and we did not randomize the sample. Our research, however, is ongoing. So currently we are conducting the WeBeWell program in spring of 2022. And moving forward, we'll look at potentially including a waitlist control in randomizing the sample. We're also very shortly going to disaggregate the data. We're interested to see if there were any differences regarding impact between first generation students and non-first generation college students, and also if there were any differences in outcomes regarding gender differences. Another thing that we're very excited about is that we are working with youth ages 13 to 18 with IRB approval to assess what the impact of our program is on youth well-being and some mental health components as well. Here is a list of my references, and I would just like to say thank you so much for taking the time to listen to my presentation. Take care.